The body is incredible. It has so much information, we barely even tap into it in order to understand what we have already been able to do with medicine. And all I can say is that medicine, where we're at in life, in the world, is almost at a level of magic and miracles. And if you're a doctor and you're practicing medicine and you're not witnessing these miracles every day, saving people's lives, then you're probably doing it wrong, or you're just in the wrong place and missing out in the right place. Towards you becoming the best version of yourself. And that means working towards a vision that you believe in, working for your patients and not working for the insurance company.
Hello, and welcome to Legends of Longevity with me, Joseph Ence. I'm your host, and I'm thrilled to have you join me on this journey towards living a longer, stronger, and more vibrant life. The podcast is about uncovering the secrets to longevity, things your doctor does not tell you, whether it's groundbreaking advancements in heart health, lifestyle tips to keep you thriving, or inspired stories of people who've defied the odds. Together, we'll explore the tools, techniques, and mindset shifts that can help you unlock your fullest potential. Whether you're here to learn how to enhance your well-being, support your loved ones, or just stay ahead of the curve in health and wellness, you're in the right place. Let's empower each other to not only live longer, but live stronger.
Welcome to Legends of Longevity. My name is Joseph Ence. I'm the owner of Vesa Labs, and I talk to and work with the best preventative clinics in America. Call it longevity, call it anti-aging. There's a lot of tips and tricks out there, and the whole industry is so large that letting you listen to two providers talk about the industry can be helpful. So welcome Dr. Silva and welcome Jenna of Bellevue, Washington. They got a dynamite clinic up there where they can do a lot of really fun stuff that's not typical on the fun stuff. So right away, Dr. Silva, I want to ask you about the CEO, but a lot of pressure in the industry. Like, people paid and they trusted this company would be there for them, and then they weren't, and they got to fight. And once you dig in, you find out that it's a rigged system. They know exactly how much they're going to deny and pay, and yeah.
It really is. Like, there's a lot of things that I don't fully understand, because I know that they have the power to deny claims, but at the same time, they're not the ones setting the prices for things like big pharma and hospitals that charge a lot of money, pharmacy companies or hospitals. And it's kind of like Walmart in a tough neighborhood where there's a lot of theft. So the prices are not set by insurance companies. They're set by pharmacy and hospitals that basically determine what things are going to cost. So if they did $1 bajillion worth of research on a drug, they're going to want to reclaim the cost on that research, not just the cost of making that drug. And so that's where costs get really confusing. And determining the value of a medication is really hard to establish that, because, well, some medication saves people's lives. Other medication just helps them lose weight. And while they're all important, just because a drug saves a life doesn't mean it should be charged like 10 times as much as something that just maintains health. So, this is a whole component of, details that I really don't know all about, but I do know that hospitals oftentimes charge way more for things because insurance oftentimes declines those claims. So then the hospital has to raise the price on the next appointment in order to make up for the loss that it had on the denial. And that is something that can quickly get out of control.
Wow.
So after it all worked out, obviously there's a lot of bad players here, and it's not all on the insurance companies.
Right? Like, people are not getting the care they need. They can't go to see the doctor they want because they are not sure of the system they got to navigate. And it becomes such a bureaucratic, these are people's lives. And I guess this kid who shot the CEO, they botched his back surgery and his male parts weren't working, and that was enough for him.
Yeah, I could see that. And as a doctor, it's very disempowering to have insurance companies determine the direction of care, especially when the doctor knows that there's a specific therapy that's recommended and part of the standard of care. And based on their plan, they're either not qualified to get it, or they'll just have to pay a lot more than they would if they had a different insurance policy that'd make it more available to them. So these types of things will definitely make people very angry. especially when it's somebody you love, like your child or something. I could imagine me being more angry if my child was affected than if I were affected. So yeah, it's human nature to be upset. And I understand the frustrating dynamics that insurance creates for doctors and patients, which is why I don't take any insurance in my clinic. I got rid of all of them, and I work for my patients, and I'm proud to say that.
That's the way it should be. That single payer system where somebody can dictate these therapies are worthwhile and these are not. Like you outlaw or abolish like whole regions of medicine. And you and I have been in the industry enough to know that there's some therapies that really do work that aren't on the panel.
They really do work. There's a lot of evidence, but they're just not paid for. And it's not thoroughly explained why. I mean, I understand semaglutide is super expensive, and if the obese population of America all got those medications, we'd bankrupt a lot of insurance companies or Medicare. So it's really not possible. But at the same time, is it really worth the money that they're charging? Right? We're probably going off on a big tangent that probably isn't fully relevant. But the point is that there's a lot of therapies that are not covered by insurance that are evidence-based and really help people. And we need to make sure that people at least know about them so that they can find that. And if you're going to a doctor who works for the insurance company and they realize that certain therapies are not covered, but the doctor doesn't even do informed consent thoroughly, saying, hey, these are the risks and benefits of various treatment options for you, which is best for you? And that's what should be asked, not what is your insurance covered today?
Yeah, if you go see a corporate doctor, you're not going to get the healthcare that you may think you want because insurance doesn't pay for prevention. It doesn't pay for optimization. That's on you. And let's get into some of that. So people who want longevity, anti-aging, feel better, live longer. Yeah, work.
And that
There's
brings it
therapy.
based on therapy. Talk
Tell me
about
more.
improving quality of life and reducing cardiovascular disease with a therapy that is off-labeled. That's testosterone therapy. And so many of my patients are on testosterone replacement therapy because they're no longer producing their own testosterone at high enough levels to prevent cardiovascular disease or the complications related to low testosterone. And there's a ton of science behind this. There's a ton of evidence. While it's not fully all explained, it's enough to take steps forward in that direction. And so that's what I always offer my patients if they're suffering with this problem of cardiovascular disease, which most of us really are suffering from that or will be because we're living so long in an environment that's quite challenging to our cardiovascular system.
Amen. So testosterone, people who get on it, they feel better, they sleep better, they heal faster, their skin gets thicker, they gain muscle mass, lean muscle mass. What else? What are the other benefits you see?
Oh my gosh, yeah, that's a big one. So basically what I'm talking about is testosterone replacement therapy that is using bioidentical hormones, not synthetic hormones. So that's the first place to start. Bioidentical hormones are essentially chemically similar to your own naturally produced testosterone. And in men, we produce it in testicles, and in women, we produce it in ovaries. And as we age, that level declines overall.
We call that andropause, right?
What's that?
Andropause, the male version of menopause.
For men, or menopause for women. And for men, it's like a slow, steady decline year after year, just a little bit lower testosterone production than the year prior. Versus women, where it can happen all of a sudden over a couple of years during menopause. And then afterwards, that's guaranteed to have very low testosterone, which automatically puts them at higher risk for cardiovascular disease.
So there's a cardioprotective in estrogen, right?
So there's a lot of different things that hormones can help with. Specifically today, since we're talking on testosterone, it's important to understand that both testosterone and estrogen play a helpful role in maintaining the cardiovascular system as well as preventing disease. But to speak with testosterone specifically, we know that that can help with lipid profiles. So if you're testing your cholesterol, we know that people on testosterone will likely have higher HDL. That's the good cholesterol. and lower LDL. So that's the bad cholesterol, and can lower overall cholesterol. So that's really important in terms of identifying people who have dyslipidemia or bad cholesterol and coming up with ways that can improve that cholesterol without incorporating a statin that might have a negative side effect. Right? Dementia and insulin insensitivity, insulin resistance. So that's the other really great thing that testosterone will provide is improving insulin resistance, which is going to lower overall blood sugar levels. When blood sugar levels are high, you get high triglycerides, you get dyslipidemia, and that contributes to the plaque that starts clogging up our artery. Beyond that, testosterone is going to have a really good effect on the blood vessels themselves, maintaining healthy vascular tone. It improves nitrous oxide release, which allows the blood vessels to relax more so that that pressure that builds when the blood is pumping is not increasing blood pressure overall to a detriment. It actually allows compliance of those blood vessels to allow them to be stretchy and healthy.
Increases flexibility, huh?
Yeah, it improves arterial stiffness overall. And that's what happens as we age naturally. Our pipes just get really stiff and old. And as the heart is pumping, it's pushing against all that resistance, which automatically raises your blood pressure. And that puts stress on all their organs like kidneys, and it's going to stress your blood vessels. So you want nice, stretchy, supple blood vessels in order to allow the pressure that's created by the heart to push blood effectively through our whole body, right?
So 100,000 miles of pipeline, and your heart has to push liquid through all. I mean, it's amazing.
Yeah, exactly. Incredible. So we know that testosterone can enhance blood flow overall.
What do you say to people who are like, I don't want to get on something I got to take for the rest of my life?
Well, I tell them that everybody's got to decide what's right for them, right? At a certain point, everybody's got to continue to do work and incorporate things into their life to maintain health and longevity and prevent disease. So for some people, they're like, I'm not going to start exercising and eating well. That's where I draw the line. Other people are like, not only am I not going to do that, but I'm going to take all of the supplements in the world to make sure that I have all the nutrients to maintain this machine so it stays healthy and strong. And then others may take it even further by taking prescribed medications like a statin to forcibly lower that cholesterol level, or even testosterone and omega-3 fatty acids, and checking all the inflammatory markers in your blood to identify risk factors that could contribute to cardiovascular disease. Right? Incorporating testosterone replacement therapy may be a step that's helpful in improving the inflammation, the insulin resistance, the dyslipidemia, and the blood flow in the body, are also improving lean body mass, right? And the muscle is, the heart is a muscle, right? And we all know that testosterone is great for muscles. So when you start testosterone therapy, you can see the heart also pumping blood more efficiently. So it actually allows more blood to be pumped for every squeeze that it does.
Wow.
It essentially, ejection fraction is more efficient and improved. So your body can pump blood more efficiently, essentially. So the list just goes on and on. I mean, there are some interesting things where we know that testosterone can play a role in the electrophysiology of cardiac muscle, and by modulating some of the calcium receptors and managing some of the metabolism. And that's super important in anybody who's suffering coronary artery disease, because the blood is needing lots of blood flow, oxygen, and the timing of all of this electricity to occur at the same time, so there's no arrhythmia. And that's what we've recently been finding, is that those men or women who are low in testosterone have a higher risk of cardiac arrhythmia. And I'm not saying start testosterone if you have an arrhythmia like AFib, but if you have a family history, if you have cardiovascular risk factors, those are all add up for you to decide if it's time to start testosterone replacement therapy. So
What are some other longevity therapies? Like, we both agree on testosterone. That should be like the number one, or should be up there on your list of things to look at. What else do you recommend for feeling better, like methylene blue?
yeah, so there's a lot of things that can help you feel better. And I recommend everybody go see a functional medicine doctor who can actually address the components that help this machine work better, right? We have engines out there that take gasoline and oil in order to run that machine. And if you don't change the oil and change some parts, that machine does wear out over time, especially if you don't change the oil or give it clean gasoline. But this body that we have is different. We're a different kind of machine in the sense that the more you use it, the better it gets. That's the opposite of what a car engine would be like.
That's pretty amazing.
However, if you are deficient in testosterone, essential vitamins and minerals, or if your inflammation is out of control, then this machine won't work as well. And
So if I believe the food pyramid, just tell me how wrong the food pyramid is and why. Because the fuel we want to eat, we want it to be clean, we want it to burn, we want it to get the most nutrition out of it. And there's a couple of things that science is that we're knocking on the door, but we haven't quite seen the products for it. For example, the gut bacteria. It's been proven that people in different cultures have different gut bacteria profiles. And the meals they eat, if they're similar, or their body tunes up to get the most nutrition out of it. There's people who have ongoing issues with inflammation or they're autoimmune, and they nuked their own system. They took antibiotics and sterilized the inside. They took a shower with alcohol and peroxide and made sure they were sterilized, and ate their buddy's poop. And this guy is a scientist and he did it all by the book, but he wanted a profile that would help him resolve his issues. And they did. Most of his issues got worked, and insurance isn't going to pay for this. And every man for himself. If you want good stuff like that, you got to go and find it. You got to bird dog it. You got to make sure you know the guardrails. And
yeah,
God bless these
you
people.
got to decide, what kind of doctor you're looking for. If you're looking to fight disease or fight for your health. And when it comes to that stuff, right, we have to look at that from a scientific level as well as an artistic level. So from a scientific level, we want to check labs and see that you have good blood sugar levels. If you're low blood sugar, we add sugar to your diet, right? If you have too high of cholesterol, then we want to lower that cholesterol in your diet.
Right.
So those are the components that we want to identify on a scientific level to make sure that you're as fit as possible. And that goes well beyond just doing a CMP or comprehensive metabolic panel or a CBC and a cholesterol panel. With my patients, many of them are getting 10, 20, or even 30 different labs at one time. So I can look at those basic components as well as the cholesterol, the fats that involve hormones, the fats that involve like omega-3 fatty acids, right? And those are all the fats that we have to be mindful of if we're looking to fight cardiovascular disease, specifically upregulating our omega-3 saturation. So I'll check a test in my patient's blood that identifies omega-3 fatty acids, and we want to get them to an initial level like 8%. Most of my patients are around 4 to 5%. And once we get to 8%, if we can get to 12%, that means the whole cell, the membrane of the cell is covered in essential fatty acids, the omega-3 fatty acids, at an 8% surface area or a 12% surface area. I have been working to get my levels up to 12% for a couple of years now, and recently just hit the 8%. But it took me years of taking at least 3 grams of fish oil every day to reach that level. So it takes real work, and it's not easy. Well, first of all, you want to get the information, find the right doctor who can guide you. Second of all, you get the labs in, identify where your weaknesses are, and start working on that, and then check it every 6 to 12 months. Obviously, if you are worried about cardiovascular disease, I recommend getting a carotid intima media thickness scan before starting testosterone or at the start of identifying cardiovascular disease. And then every 6 to 12 months, continuing to check that CIMT will help to identify your progress. On the final level, like as I was saying, through the artistic aspect of things, well, and not everybody is the same, right? You have to you have to offer custom approaches for patients based on their situation, their genetics, and their stressors or diseases. So if somebody has a high stress level and they have a high family history of cardiovascular disease and cancer, well, then we want to weigh the benefits of testosterone therapy for cardiovascular disease, but also look at the risk of testosterone in the setting of cancer. So
Interesting.
probably a whole nother direction we could go down as well.
We could. So
Testosterone does not cause cancer, but rather low testosterone can stress out prostate cells that causes them to change to an unhealthy state. And
I'm glad you shared that.
even become cancer,
Interesting.
but it is not cancer that
So let's start talking about, if I was a consumer and I wanted to find the best doctor for my issue. If I was a consumer and wanted to find the best doctor for my issue, I like functional medicine doctors. That's a good curriculum they do after medical school. It's like 1,000 or 2,000 hours of additional work. But what other flavors of medicine do people not traditionally consider, assuming they want to get away from corporate healthcare? Because in a 10-minute appointment, you're going to get a prescription for something, and you're not going to solve the issue. The doctor doesn't have time to consider all the options or relay to you all the options that insurance may not pay for or care for.
Yeah.
He doesn't want to make you angry. But if you're a consumer, like, what things would you reconsider if, now that the industry is in the state that it is in now?
Well, I mean, I would say that, you got to go to the right person for the right tools. And not every doctor has that set of tools or knows about functional medicine. And the difference really is, is your doctor addressing symptoms? Like, I have chest pain, so can I have something for that pain? Rather than, I have chest pain,
It's picking up.
and let's look at the root cause of that pain. Do you have clogged arteries that's causing, your heart to hurt whenever you exercise?
Yeah, let's talk a little bit about heart attack and stroke prevention, because I like it. I don't know if I told you this, but I was at that booth and I found out about Natto Kinase. Natto is this Japanese breakfast they eat. And I actually got some here. It's about 80 cents a serving. It's fermented soy. So if you've ever been on a farm, it smells like a bucket of wheat that's had water in it too long. Anyways, research came out that said that it's reducing natto. You can buy a supplement in pill form, and the serrapeptase, nattokinase and serrapeptase. Serrapeptase is the enzyme the silkworm uses to gobble its way out of that cocoon. And those two supplements, some research came out showing that it opened up arteries. It removed plaque. It took that calcified plaque and redistributed it, hopefully to their bone, but it definitely opened up the arteries a little bit. So I have two little plaques that I'm tracking, and they appear to be shrinking a little bit. They're not as bright. So this is one of the therapies that I like telling doctors about, because we heard about the blue zones in Japan and in the Mediterranean, and we were told to eat the Mediterranean diet, but I never got a good workover on, hey, what do they eat? And this is one of those things that definitely there's research behind it. It's very cheap. I don't love the taste of it yet, but I will. And I'm trying to increase my cardiovascular with real food, right? There's magic in fermentation, and there's magic in fermentation and fungus. I haven't gotten to the fridge.
That's for sure. Yeah, I'm a big fan of nattokinase. I recommend most of my patients get on it, especially if they already have cardiovascular disease to some extent. And it's known for helping with clots and blood pressure, lowering cholesterol and plaque. So it's definitely worth a try. However, some doctors won't prescribe it or recommend it because we don't want patients replacing important heart meds with nattokinase, right? We don't think that this is a substitute for statins
Right.
or aspirin.
Like, I'm sure they'll turn into something like red yeast rice was the precursor to statins. And there's a lot of patients who want to eat the red yeast rice because that feels more natural to them.
Yeah.
Fascinating stuff. Oh, did you know that patients, if the doctor writes a prescription for food as a prescription, patients can use their healthcare dollars, or what do they call those, to pay for that tax-free. So it's a good way to avoid the taxes.
Like that HSA.
Yes.
Yeah. Wow. So if I just say, eat more red yeast. Oh,
You can put them on a vegan diet, prescribe, what you want.
oh, okay. Wow.
Yeah, I heard about that. I haven't talked to an accountant, and this podcast is for entertainment purposes only.
Right. You got to find your doctor to make sure that you get treatment according to your situation. Don't take anything that we say here as medical advice.
Right. We're just two guys in the industry talking about the cool stuff we see and what we recommend. But yeah, the whole industry's changing. Insurance, people aren't trusting it. We saw the United Healthcare thing, and people want more control. And so I'm kind of curious to see how this plays out, because rich people are paying cash for the services they want. The rest of us are trying to get our insurance. It's a constant negotiation, which only slows things up.
Yeah, super frustrating. More importantly, though, is that patients have the right information to make the best decision for themselves. And regardless of what's happening, unfortunately, there's such a shortage of providers and physicians that, and that the insurance is constantly reducing the pay, that appointments are getting shorter and shorter, and time with doctors are decreasing. So, many of my patients, I spend like an hour with them to try to discuss their situation, while other doctors only have about 15 minutes. So doctors got to either direct patients to get that information somewhere else, or, people like you have to start podcasts so that people can start to learn more.
Yeah, any doctor who I know who has a boss watches their time and their turnover and their billing. If you can find a doctor that doesn't have that environment where they can spend time with you, once, twice a year, really dig into your issues, order the blood panels. I would like to think the most successful relationship are like when doctors are advocates or educators, and a patient will switch doctors every few years. I mean, there's nothing wrong with having a perfect best friend doctor to fall out, but people are hungry for information, and you're not going to get it all at the same well. You gotta hunt and find.
Yeah. And I encourage patients to get second, third, and even fourth opinions on things, because everybody's going to have a different take, especially those doctors who take different insurance or don't take insurance. You're going to get a completely different recommendation. So if you go see a doctor like an orthopedic surgeon for knee pain, they're going to probably recommend cortisone or surgery or, NSAIDs. Versus coming to me, I won't recommend NSAIDs. I'm not going to do surgery, and I'm not going to usually recommend surgery, something so invasive and risky, before trying something as simple and as easy like PRP injections. And PRP injections are much more healthy for you because your body made it for healing, versus cortisone, which is going to drive up your blood sugar levels, increase blood pressure, and worsen your cardiovascular risk profile. PRP won't do that. Stem
Tell
cell.
me how you get the PRP. You draw blood?
Yep. We draw a large amount of blood to ensure that there's a high concentration of growth factors in PRP. When we inject all of those tendons, ligaments, joint structures, and nerves, they all get better and start to mount a whole healing response.
Yeah, tell me more about stem cells, because from what I'm reading in the literature, there's cooler stuff that is commercially available and advertised. I went to the Peter Diamandis Fountain Life, Fountain Health. I do scans for those guys, and I love the work. I meet the most incredible people, but they're talking about going to Costa Rica to get the stem cell treatments they want.
Yeah, stem cells, you have to be careful of that. I only recommend you use your own stem cells and nobody else's cells, because DNA is not fully understood. And when you get someone else's DNA, you run the risk of carrying some sort of disease that they're programmed for. And that could include cancer and other diseases as well, right? These are living tissues. So if you're going to take a living tissue from somebody and put it in your body, then there's a chance that bad stuff will come with the good stuff. A lot of doctors get away from that by injecting dead tissue, like something in a vial. And so if they say that they're giving you a stem cell injection, there might be stem cells in there, but they're all dead. And at this point, they're not going to do a whole lot. So you're better off just having like a PRP injection over some overpriced allograft tissue. Allograft means it's somebody else's tissue. So what I recommend is that you only use your own cells for your own healing. And with that, you're doing the best you can to help your body heal. And with that, when you're injecting those stem cells into all those little structures, it's important to have precision so that those cells and growth factors directly are injected into the torn ligament or tendon that needs to heal. If you're just putting it in the area, we can't just guess and hope that these tissues can heal unless they've been delivered a huge, cargo load of growth factors and cells into their ligament or tendon that's torn.
You're not kidding about precision. I mean, in your office, what tools do you have just so you know you get exactly right where it needs to be?
Yeah, we're using X-ray, which is known as fluoroscopy, and ultrasound guidance. Oh, Joe, I've been seeing some new ultrasounds out there from Canon and Samsung. Are you familiar with the i800 Canon? Oh, my God. I just drooled all over myself when I saw it because the incredible detail. I'm like, oh my God, this is like $180,000 ultrasound, but I think it's the best the world has to offer right now.
I cannot wait to play with it.
I really want one. So if you have connections with Samsung or Canon, let me know because I'm seriously going down to look at those.
Yeah, I got to find out when the next trade show is so I can play with it at a booth or.
Right.
Right. When I was a teenager, I broke my little sister's leg and we go to the ER. They put us in a room in the back with all this wonderful equipment and they told me not to touch it. So they left, I fired it up, and fluoroscopy, like to a teenager that you can see x-rays of your hand in real time, putting my head in that machine and trying to incredible. And when you expose kids to stuff like this younger, their brain gets to work on it and understand it and get creative with it. So I'm a big fan of making those toys available to the local high schools. And in fact, I donated a machine to the local because it's important. The ability to look under there's tools out there that, take a lifetime to understand.
Yeah. And they're ready available to most doctors. So if your doctor's not using it, I really wonder what the excuse is.
Yeah. Right. I got to see someone every 10 minutes. I can't be.
Yeah. Patient comes in. I only have 10 minutes. Well, guess what? It's going to be a whole lot faster for me to put the ultrasound on that shoulder than to go send you and get an MRI, right? To identify a rotator cuff tear or some problem.
Yeah.
And a lot cheaper too. But, the biggest reason why I know doctors don't do ultrasound diagnostic imaging is because insurance doesn't pay for it. So you could do like a 1-hour report, you scan everything, label it, you get $20. That's basically, if you're lucky, you get $20.
Yeah. I believe most people have a calling, not everybody, but most doctors are healers and they want to heal. They want to get right in there and fix you up and summon everything they can to advocate for you. But the system denies that. It's not a friend of that. You can't grow in that. So finding a doctor that you can work with is important. It just takes a lot of effort.
It does. It's important to find a doctor you trust and you like, and a doctor who's also healthy, living their talk, right? They're not just saying lose weight and stop smoking while they go take a smoking break. This is what has to be. It's in alignment. When the doctor knows what's up, they're going to do it, right? If it's really good for you, why aren't they taking their own advice?
I had this one doc I did lunch for, suspenders, big dude. He's like, bring a bucket of chicken. And you would pitch to him while he was just not gracefully eating this bucket of chicken in front of you. So yeah, it's important to find a doctor that can walk the talk, that they live a lifestyle that's sustainable. Because if they're telling you to do stuff that they won't even do, then they lose their credibility.
Yeah. Yeah. I wouldn't start a statin if I had abnormal cholesterol. So I wouldn't prescribe one either.
Yeah.
Unless I knew that somebody had some familial out of control cholesterol, that was the only option. But unfortunately, doctors go straight to it as their first example
Well, yeah, they go to it because the patient's not going to lose weight. The patient's not going to change their diet. Like that is all they can do if the patient's just going to take a pill.
Yeah. But does the doctor give informed consent? Does the doctor say, hey, when you take this statin, your cholesterol will lower, but your insulin resistance is going to worsen? So that means your blood sugar is going to raise, putting you at higher risk for type 2 diabetes. And that's not good either, right? That's going to increase your cardiovascular risk as well. So if your doctor is prescribing that to you, you have to know this information. You have to know the difference between relative risk and absolute risk. And that's where a lot of doctors seem to get convinced by the med reps. They say, hey, if you give this patient of yours a statin, you're going to reduce their cardiovascular events by 50%.
Would it be nice if the doc said this pill is equivalent to walking, half hour a day? You can out-eat this pill. You can out-eat the effects this pill will give you. But it's a shortcut. The walking's better for you. You'll think better. Your body will start using the insulin. Your muscles will train to metabolize it. If you do that, or you can eat this pill. Like because the pharma reps are paid on pushing. So it's always interesting to see how the doc knows his subject, what he parrots, because it may be the only education he's gotten on that subject is what he's gotten from the pharma rep. Yeah. And cholesterol, I can tell who's taught who based off of the information.
Yeah, I would never go off of a single cholesterol reading to tell a patient that they have a high cardiovascular risk. I basically go further and look at the lipoproteins, the inflammatory markers, and all those things that actually give us a clearer picture of their risk. So I have a lot of patients who are super healthy, but their LDL is really high or a little high. It's like they have a 220 or 230 total cholesterol, and it's all because of LDL, and they have a high HDL. Well, those patients, I'm going to say, hey, we should definitely continue to observe, get a CIMT scan, check your biomarkers, incorporate lifestyle changes, look at any deficiencies and address them. And that includes testosterone replacement therapy, omega-3 fatty acids, and the like. And if we get all of those things tuned up, then having a little elevated cholesterol is no big deal at all.
Your body needs that stuff. Your brain operates on it. Your gonads operate on it. It's important stuff.
It is so important. I mean, cholesterol is so important for the brain as it helps to myelinate all of the nerves. And if you take a statin that impairs that myelination, then you have a higher risk of dementia. Right? So that's another risk of a statin. I also get a lot of patients who come to my clinic with pain. And I'll say, I see you're on a statin. Did this pain start when you started the statin? Actually, doctor, it did, come to think of it. And we stop it, and then all of it goes away, and they don't need any stem cell injections anymore. So, but yeah, there's so much there that really you need informed consent. Essentially, my entire appointment is informed consent. It's, hey, let me teach you, let me talk to you and educate you about all the things that you need to know. Yeah, hope that you get all this. So,
right, to make a good decision, this is what I think you need to know. Yes, it's not.
If you were my family, this is what you need to know, right? And that's how I treat all of my patients. I'm like, we don't have much time. Let's go. Bye.
Right. And how long can you talk to a patient until you understand, till they're not listening anymore? Like, because you want to share. Most doctors want to share. Are there limits to the way to do it effectively?
Yeah, it's really tough because you get patients who are already sick when they come to see you, and their absorption rate is not very high. So we hope to establish some rapport and trust and take little baby steps in that direction. And over time, as they start feeling better and seeing that it works, there's a spiral into control that just gets better, be getting better. Like you feel better. So now your mood is better, and you decide to go for a little walk, and now you have a little more energy, and then you sleep better and you wake up more refreshed and you start eating better, and better begets better. I mean, it's just to no end. And that's where I'm at right now with my own health in terms of identifying all of these incredible technologies and supplements and studies that help us to identify what's really going to improve the quality of our life. And it is so abundant right now. There is no shortage of ways to improve your happiness, your quality of life, your energy levels, your strength, and reducing your risks for disease.
Mm. Yeah, I totally agree.
We're in a great time right now. There's so much opportunity.
Too much, too much good things. I can't stand. It's frustrating, and I can't learn it all and stay on top of it. But
It
I
really
agree with
is
you.
frustrating.
Good habits stack up, and
I
that's
wish
part of my whole.
I bet, because you're out there in the world, going to workshops, meeting various doctors and patients, and you're seeing it all go down live.
Yeah, yeah. And there's a moment where I start working with people, and as soon as there's too much info, people shut down. So I try to really break it up into the simplest steps. And when that light bulb goes off, hey, we're done. We'll pick up later tomorrow. Practice, we'll work with it, but like immersion's the only way to really learn things and get people to change habits and stuff.
Medicine is complex. If you can find a teacher or a guide who really simplifies it for you, it's totally worth it.
Yeah. All right. Stem cells. I want to learn more because I know there's things they can fix. What are the coolest things you can fix with stem cells?
Well, the coolest things that I can fix with stem cells are the things that usually are fixed by surgery instead. So, like a pretty good slam dunk is a partial tear ACL where you're kind of stuck in the middle. You go see a surgeon, they're like, well, it's not fully torn. It might heal it, but clearly it feels unstable and it's just not allowing you to go 110%. So you come and see me because the orthopedic surgeon has no tools to regenerate. Unless they're doing regenerative medicine, they only have that which the insurance tends to approve, which is like cortisone shots, ketorolac NSAIDs, hyaluronic acid, surgery.
Don't forget physical therapy. Very important. First,
Of course, rehab is the mainstay of every single therapy, no matter what you do.
like as an MBA, I like looking at why to have certain protocols. In physical therapy for lower back pain is like, that's the first thing because in 5, 6 months, it may resolve on its own. The physical therapy could do it. Like that's the cheapest way through. If it still hurts after 6 months, then the insurance will start paying for cortisone and stuff. But they don't really give you a fix. They don't give you the tools on how to control your destiny.
Yeah, and that's a tough one because that's a little bit of my own frustration dealing with non-specialists, right? You get a person who goes to back pain to the primary care doctor, and the primary care doctor is going to be like, all right, we'll continue to observe. Or here's an NSAID. They'll usually do that before they actually try to get the precise diagnosis. And obviously, if you have short-term back pain, that's less important than if you have chronic back pain. What you need is a precise diagnosis so you know exactly which joint is hurting you and why, and so that you know what to do or not do to help yourself. And that is commonly like patient coming to see me and we get some x-rays, we do a thorough physical exam, and we can see that there is a joint in the lumbar spine that's arthritic, contributing to all of their pain. We can treat that, but we're not just trying to put out the pain and the inflammation, we're trying to support that joint for the long run. So stem cells and PRP are injected into all the other functional components that support that joint, the ligaments, the muscles, the tendons, the nerves, the disc, and anything else that's going to help that joint work better so that it feels better for the long run. That's one, getting a precise diagnosis of what's wrong, and two, doing a comprehensive root cause protocol to treat that problem so that it doesn't come back right away. A lot of cortisone will be injected and help you feel better, but it's going to come back. It wears off and you're left with the same problem or a worse run because cortisol is toxic to cartilage. It raises blood pressure, blood sugar levels, and it worsens tendon, bone, and ligament health. So if you inject that into those structures, literally, if you injected all the things that I inject with PRP and stem cells, with cortisone, you would be in the opposite direction. Everything would get worse. Your spine would fall apart. Pretty wild, huh? So why do we even allow cortisone, right? That's crazy. It's almost bordering malpractice.
Yeah, there's so much better stuff out there. And the only way medicine changes is dead bodies. Doctors, what they learned in their prime, they're still doing. You need fascinating.
Yeah. Exactly.
All right. So The Dark Knight, when you saw Batman's joints, were you like, I can do something with that?
God, I don't remember that movie. But yes, I can do something with everything. Essentially, if you come to me and your back is so bad, you've had 5 surgeries, you're on a ton of pills, you have horrible metabolic health, I would recommend you start with functional medicine, get your metabolism aligned, your blood sugar sensitized, and your hormones optimized, your inflammation lowered, and all your vitamins and minerals as healthy as they could be, right? That's the beginning of how you improve the mechanics of your body. Then when I go and draw your PRP and your stem cells and I inject that area, you're not going to be overburdened by runaway inflammation or prolonged healing and recovery times. You're actually ready. Your body is ready to heal. And so it knows how to navigate the inflammatory state, which is the activation of the immune system by stem cells and PRP, which take it to the very next level. It graduates from inflammation, goes on to proliferation, where now every single little tear is starting to knit together. The proteins are being laid, they're getting tightened and stronger. So when you start putting pressure on it in that proliferative phase, it's like a gentle breeze that makes the plant stronger, right? Little by little, that stem gets stronger and stronger as it gets the appropriate amount of stress at the time that it can handle it. If your body can't handle that stress,
Just
the
get
stem
well.
cell PRP injections may not provide the best outcomes,
Fascinating.
right?
I love what you said at the beginning. Like the body's a machine that gets better the more you use it. It tunes itself up.
Give you did it what it needs, right? We're a meat bag. We control all of the fat and muscle in our body with our nerves, right? So who we are, I think, are really just a bunch of nerves.
Some people's children.
Some people have more nerve than others, that's for sure. But yeah, so if you're trying to remote control this body through all these nerves, you want to make sure that the nerves have the myelin it needs to conduct that signal, that the meat suit has enough protein and fat, healthy fats, for it to repair itself, and that all the mechanics and little intricate details like your gut flora and your hormone levels and your vitamin levels are adequate enough so that your body can repair itself. If it doesn't have what it needs, if your body doesn't have what it needs, it won't repair itself. And that's where people and doctors get lost and confused. They're like, why am I not healing? Well, first of all, you need to incorporate healing mechanisms, not suppressing healing like a cortisone shot or an NSAID. That's suppressing our own natural abilities. And a lot of things in our life suppress our own natural abilities, like all of the pesticides, the BPA out there, the plastics and things that suppress our own testosterone production or transmission or activation on the receptor. All our receptors are clogged by all these fake, hormone-like chemicals that prevent us from actually stimulating the true receptor or, the downstream effects of testosterone.
Isn't the American population, our testosterone is down like 40 or 50% compared to 40 years ago?
Yeah, I really need to find out more about that trend. I haven't been able to find that, but I'm basically seeing very low levels of testosterone in young men that are similar to the levels in old men. So basically, the Gen Zers and the millennials have the same testosterone levels as some of my baby boomers who are 70 years old, 60 years old. Does this make sense? Like, I don't get it. They're younger. They should be healthier.
I tried looking for an answer for it, and it seems like it's the seed oils and the sugar, the corn syrup. The mice studies showed that it reduced testosterone in mice 40%, but
Yeah.
you can't find the human studies. It's not easily findable. And then the seed oil, that actually makes plastic. If you put a potato in it, it creates a version of plastic that your body has to digest. And that canola, I mean, in the 1990s, America, we switched from tallow-based deep frying to these seed oils because they're like industrial. They don't go bad. You don't have to change it as much. It's a good business decision. However, the cost is huge. And there's apps and like seed oil finder. You can find out who has aloe, but everybody knows it tastes better. The research is out, but it's so much cheaper and so effective, but it's hurting our population.
It kind of makes sense, right? If we're made, if our body fat is animal fat, then eating animal fat seems the best way to supplement or replace our losses.
Yeah.
Right? So like, that's what we're made of. So why not consume that which we're made of?
Yeah. The minimum daily requirement for carbohydrates is 0. Like the FDA acknowledges you don't need carbs. They don't.
Right?
And so fat.
Great for energy. And that's what you should see them as, like little fuel packets.
Yes. I mean, if you got diabetes, that's how you do look at it. It's just too much. And it makes you hungry. I mean, it doesn't satiate you. So I had a big pivot in my life when I started putting cream in my cereal or my hot cereal in the morning, or like just trying to get as much fat to stay fuller. And I lost 84 pounds just trying to get rid of seed oils. And
you lost fat by eating fat, healthy fat, right?
no, it didn't make sense.
And that's the thing is like these seed oils, it's just that they're not natural. You would think, oh, sunflower seeds, what's wrong with them? Nothing, actually. They're great. But when you process them and expose them to all kinds of harmful chemicals, suddenly they become a poison.
Yeah.
And it's kind of interesting that, how you make plastic is just by adding a free radical to fat. So if you're making PVC, you take a whole cup of petroleum oil and you put a chlorine-free radical in it, and it creates a whole chain reaction in which all of those fat liquid molecules create a matrix and become a solid. And that's what happens in our own body when our plaque, when our unhealthy fat or cholesterol collects on the wall of an artery. It can remain soft for a long time, and soft plaque is reversible, and it's okay to have that. And I can actually see that on the CIMT scan and say, hey, this is soft plaque versus the hard plaque that's calcified. It's really stubborn and it's hard to reverse that. So you always want to take things when they're in their reversible state to improve it. So if you're going to try to improve that plaque, you're going to take a lot of antioxidants so that your soft plaque doesn't get exposed by a free radical. Even oxygen is a free radical. And we've seen it in marathon runners. They have terrible cardiovascular disease because they're exposed to so much oxygen on the plaque of their arterial wall. So if you're not consuming enough antioxidants like omega-3 fatty acids, vitamin C, zinc, and all these other things that help to maintain the cell, then the cell will become calcified and turn into plastic. Your plaque will become hardened and clog your blood flow. So this is kind of crazy but that's the science of it. And your body's a whole like petri dish of things happening that you just keep putting the right things in and you'll get the right things out.
Wow. Thank you for dropping that on me. The best I got to add to that is one of my doc's friends is like, God puts the poison where he puts the antidote. If you drink just orange juice, that straight sugar, and pound that, not so good for you. But if you eat the whole orange with the fiber and all the nutrients there, you get more and you're satiated more. You're not as hungry. The pulp, the roughage, all this processed food there's things we're not planning on.
Yeah. And although we were meat suits and I recommend eating meat and healthy fat like that, I do acknowledge the value of phytonutrients and fiber. That's where we just can't get all of it from animal-based sources. We need the phytonutrients of plants and especially the fiber in order to feed the bacteria in our gut, because our body can't break down those fibers. Only bacteria can. And when they produce, you're basically feeding the animal you want. So if you're putting a lot of sugar in your intestinal tract, you're feeding yeast and microbes that will probably hurt you rather than feeding the microbes that will help you. So you have to get a hugely diverse
Yeah. So
Right.
I learned recently
source
that
of fiber. And there's tons of different types of fiber. And that's where you just can't get it all from diet, especially not the American diet. You have to go take a scoop of that weird powder that tastes like dirt because it looks like dirt. It's probably grown out of the dirt and probably has a little dirt in it, right? That's the stuff that's going to be good for your GI tract.
what's the stuff?
Not just like taking Metamucil, which is just really a single type of fiber. You want a diverse amount of fibers that come from lots of different types of carbohydrates. That's a carbohydrate technically.
Like our diet is so.
It's not going to raise your blood sugar.
Hey, did I read that sourdough bread does not raise your blood sugar?
Right. There's a whole component of the flora having an effect that improves the response to that bread so that it doesn't cause as much of a blood sugar spike. I forget the details, but you're right. There is something about sourdough that's magical.
Fermentation is magic.
Fermentation. Oh my God, the fermentation proteins that are coming. Oh my God. That's going to be revolutionary right there.
Go on.
So, fermentation protein is essentially a synthetic production of protein that would normally happen in, an animal or some sort of biologic entity. So if you want milk, you have to raise the cow for it to eat and stay healthy. You milk the cow and you have your milk proteins. But now they're going to combine a bunch of different bacteria who produce those proteins and in a vat, right? And those proteins will be produced in mass at 1% of the efficiency that a regular cow would. So take all the energy, time, and work to make cow from a milk, subtract 99% of that, and now you have milk through fermentation proteins that are the same thing, pretty healthy, and very cheap and abundant for everybody to be able to get enough protein and fat. So there is, we're basically entering a world of great abundance where there will be no shortage. There will just be greed that prevents people from, enjoying and participating in these benefits.
Yeah, I agree. It's an abundant world, and it's knowledge and sharing and helping your brother out, brothers and sisters.
It sure is. This is really great. I really like talking to you, Joe, because you're somebody who just has a very strong critical mind that is it analyzes, takes things apart, and it looks at them from a perspective like, how can we make a difference? How can we help each other? And I think that the company you're doing here is is providing a great service to humanity. I'm so glad that I offer it in my clinic. Thank you for bringing CIMT into my clinic.
Thank you, Doc. That is a heck of a note to end. Thank you for being here. And let me riz you up a little bit. You have an unusual practice, an unusual backstory where you like learning and you like helping people. And you happen to be in a niche where you can get the cool equipment and offer it directly to your patients. You are a really good consultant. Like, you have a really good command of all the new technologies out there, and you're willing to invest your time and attention to helping that patient get better. You've been around. You're one of the few docs who will like drop what you're doing and go get some knowledge. We were talking a few months ago about a doctor in Germany who's doing incredible things. And your staff told me, hey, if you can get that patient in with that doctor, Silva wants to go because he wants to learn that stuff. And then you'll bring it back and give, like, I don't hear that about other doctors. I don't hear that journey happening. So yeah, man, we're teaming up. We're going to help people help themselves.
Wow. Thanks for that acknowledgement. I decided a while ago that I didn't really want to work for money, and I'm trying to dig myself out of that situation. And you don't need money to like make that decision. You need to focus on what's important And people like you and my family and friends, they are what's important to me. So my mission as a doctor is to learn as much as I can to help all of those people and myself. If I'm not learning how to help myself and others, and I'm just making money, that money's going to be worthless when I'm sick and tired at the end of my career. I won't enjoy retirement. And so basically, I'm on a mission to really understand health so that I can help myself and my loved ones. I know that I'll probably have, an incidence of, I can say that I've been dealing with pain and I've been finding the solutions to my own pain. And once it's proven that concept, then I offer it to my patients. And I may even face cancer one day. So I'm on a mission to understand what causes cancer and how I can prevent it. And if it came around, is there any cellular therapies that can help fight that cancer in a natural way? Kind of like the statin does, kind of like how functional medicine does instead of taking a statin. So
Yeah.
I really believe in the power of the body. I know that we can heal. The body is incredible. It has so much information. We barely even tapped into it in order to understand what we have already been able to do with medicine. And all I can say is that medicine, where we're at in life, in the world, is almost at a level of magic and miracles. And if you're a doctor and you're practicing medicine and you're not witnessing these miracles every day, saving people's lives, then you're probably doing it wrong or you're just in the wrong place. Then listen, in the right place supports you in becoming the best version of yourself. And that means working towards a vision that you believe in, working for your patients and not working for the insurance company.
I mean, the level of medicine today, there's a lot of, you go to a third world country, you're no different than Jesus. You can help people rise and walk in a relatively short amount of time. There's things that are easily fixable. And now in America, it's to the point we're tuning up and we're fighting our environment for forever chemicals and good nutrition. And how do you find good food that's not corrupted? Like the whole world of dried fruit. There's things you can do, but yeah, a healer to help engage patients and bringing it all home. Yeah, I subscribe to your philosophy. I'm here to help others. There's no other greater purpose. I love it. All right, I'm going to send you a present. I send these to my favorite providers because my life is dope and I do dope. So this will be in the mail. I don't know if you want to put it where patients can see. My sister did wear it, and it's got a naughty word on it. It took some negotiating. But yeah, thank you very much, Doc. I appreciate it.
So for taking the time today. Look forward to the next one.
Heck yeah. Thank you, brother. Thank you, Jenna. See you guys next time.
Thanks, Jenna.